I'm John Andazola. I'm the program director of the Southern New Mexico Family Medicine Residency Program. Well, the Family Medicine Center not only trains residents, but it provides patient care, and I think that's an important thing. I tell my faculty that our priorities are number one, patient care, and a very close number two is resident education, and then everything else falls below that. So patient care comes first, and our patient population, we see about 8,000 patients, that's unduplicated patients per year, which comes out to be about 22,000 patient visits a year. That's provided by our patients. We provide cradle to grave care. We deliver babies. We do prenatal care. We see people at bedside, and we see people in hospice. We go to nursing homes. We do home health care. We take care of children, and we take care of grandma and grandpa. And so it's all provided in our clinic. We also are lucky in the fact that we can provide care to as many people as possible. And what I mean by that is if you don't have insurance, we have a financial counselor. We'll get people plugged into whatever assistance programs exist. We'll work on sliding scale. We work on payment plans and on fee schedules to provide care to patients. So we are lucky in the fact that we can do that. Medicine is very siloed and fragmented, and so you have cardiology or gastroenterology or family medicine or mental health or other things like that, but the human being is not fragmented. The human being is a whole person with whole needs. The new move in medicine is to use the expertise from your team to provide the best care possible to your patients. We always talk about biopsychosocial medicine. Bio is kind of the doctor stuff, you know, the chemistry and the physiology and that. The psycho, of course, is the person, the mental part, the spiritual part. In our clinic, we are gifted that we have 2 psychologists that actually have prescriptive authority. That means they can write prescriptions that teach our residents. They work side by side our residents, and they're there when we're in the hospital rounding or there when we're in the clinic seeing patients. And they help us provide the most well-rounded care to the patient. When I talk about psychology, I'm not talking about just depression or anxiety or any of that kind of stuff, which is important, and we treat that. But I'm talking about the day-to-day living. And I'm going to tell my story. So I tell everybody this story, so you guys will hear this story again in the future, I'm sure. But if a patient comes to a doctor for diabetes, a patient comes to me, new onset diabetes, I write a prescription, here's the pill that you're going to take, here's your new diet, and here's your exercise plan. I'm going to send you to a nutritionist, I'll see you in a month. They come back to see me in a month, they're not taking their pill, they haven't changed their diet, and they're not exercising. Well, why is that? Well, I provided them education, I sent them to a nutritionist, I've talked to them about the disease. It's because that's behavioral change. You have to change your behavior. That's what the psychologist adds. That provides that better wraparound care to my patients and increases their compliance with their medications, but it also increases, it allows them to see where the roadblocks are from healthy lifestyle and helps us improve that. So providing that kind of care in a training program trains residents to understand that care. And so when they leave, they expect that care and they build that care into their practices. The other part of the story is we also train the psychologists. So PhD level psychology students rotate with us at the Family Medicine Center from New Mexico State University. And so the psychologist gets to see what life is like in the doctor's office and what it's like to treat medical patients, as well as the physician knowing what it's like to work with a psychologist. So both individuals graduate from this community with an understanding of integrated care. A pharmacist also spends time with us rotating in the clinic and rotating on the hospital. In fact, he rounds with us every day. And that extra pharmacy experience and expertise in medications provides that extra level of safety and care to our patients. So our patients can have complex diseases, they could have medications that are not to be utilized with you because you have kidney problems or because you have heart problems or liver problems, or medications that don't mix. And the pharmacist reviews that, gives us advice, and increases our care. So I think our patients are pretty darn lucky to be with us in the hospital because they get the doctor, They get like 3 doctors. So they get 2 or 3 training doctors plus the supervising doctor, plus a pharmacist, plus a psychologist, all working on their case together.